classrooms so that students really are able to do social distancing inside the classrooms. And we're doing the same thing in our cafeterias. And it's challenging, like Carrie said, the students are just so happy to be back and they're glad to see one another. So it is a constant reminder as we're in classrooms and we're working with principals, we see often that principals and teachers are doing, it's time to do a mass check. And so they're doing that as well. As far as the testing, as I shared, we are testing weekly. We're testing our staff weekly as well as our students. We are at the point now where over half of our students are being tested on a weekly basis. Because we are getting matter from students, parents do have to give consent for that to happen. But the consent is pretty simple and the testing happens at their school location. So we are prepared for all of our students to be tested and really encourage that to happen as well. In terms of our staff, we're doing the same thing with them. We haven't gotten to a point yet where the vaccination is required, but testing every week for all of our staff is absolutely required. As we move outside of the school building, so that's inside the school building. As we move outside of the school building, we continue to look at the requirements and the expectations for distancing that are given by MDHHS as well as CDC. And our guidance, again, comes from the health department. So we honor those things and we follow up. We talk to our principals often about it and have availability to answer their questions also.
So Carrie, before you go, I just want to summarize that for parents that are listening. So parents, if you're at DPSCD, you have to opt in for the testing for your student, if I heard you correctly, Ironetta, and that you have testing locations. All schools have the ability to test, so that the testing will happen at the school location, correct?
That's correct.
Awesome. Okay, great. Carrie, go ahead.
Thanks. As Ironetta said too, it's really about following the data and the science to create buy-in from all the stakeholders and both like inside the school building and outside. I think, and then furthering the buy-in is providing an endless supply of PPE, albeit masks or those air filtration systems, and, talking the talk and walking the walk when it comes to providing these resources to our families and to our staff. And I think, just again, always referring back to like, we believe in the science and the data that the Detroit Department of Health provides, that the CDC provide, and all of the policies are grounded in that and discussed amongst, attorneys and the school boards with the superintendent and school leadership. So everybody's on the same page.
So we all know that we're living with COVID right now. And there is going to be a possibility that someone tests positive. I just had my son, somebody in his class did, and I had him tested 3 times. Just because he got symptoms, right? Like he was fine and then he got symptoms, and just to be really sure. So all of us parents, I think, are thinking about that, both just to know, but also to keep our community safe. And so I think we have a slide where there has been guidance that has been given by, I believe it's the CDC. Are we going to show that, Molly, the slide? Because what we were curious about is, once somebody's been exposed, like my son, what are the policies that you have for testing once someone has been exposed and or someone has gotten COVID, and what are your requirements for quarantining? And you both talked about a system for testing. And then are you following the guidance that is included on this slide? That was a lot of questions at once. So Ironetta, if you'd like to go first.
I will go first. I live with these experiences daily. We work very closely with our Office of School Health and Wellness, which is also our partner office that works with the Detroit Health Department. So we follow that guidance after going through. So it can start in a couple of different places. The first would be if we, and this is a benefit of our students and our staff testing through our process. If staff members or students test positive and they're testing at one of our locations on site, we get the information as soon as it is shared with that particular individual. So it's automatic where you register through Links DX, that's the organization that we use, and then we get a report that says there's been a positive case at X location. At that point, we start the surveying process to determine who the close contacts are, who the individuals are that are around them within that 15 minutes over a 24-hour period. They're within 3 feet of them if they're inside the classroom, and 6 feet of them if they're outside the classroom, or if they're an adult, because that's the guidance from DHD. From there, we then start notification. So we notify those that are positive, because sometimes we know before they do, even though the message goes to the email box that the parents use when they register. And I think that's really important for our parents. So our parents that are in DPSCD, when you give your child permission to test, the email box that you use, the email that you give is the mailbox that the alert will go to get your child's results. And so they get a result, whether they're positive or whether they're negative. Okay. So I think that's really important. From there, we do the notices to those that are positive. If we know before they do, we do any notices for close contacts so that they know immediately that they are to start the quarantine process. And then we begin to notify the overall school community. There is a difference based on guidance, and this slide is a little small for me, Molly, so I think that it's on here as well. I see vaccinated and unvaccinated. So we know that our fully vaccinated individuals, which we do, thank you, which we do follow that guidance as well. Our unvaccinated individuals, their quarantine time is different. Their quarantine period is longer, and it does depend on their level of exposure. And our vaccinated individuals generally don't have to quarantine if they don't have symptoms. Of course, anyone that has symptoms, there is a different level of follow-up. The one thing that's updated from this guidance, and this is really new, and so I am not sure that it's on the Detroit Health Department's website yet, but it was updated last week from DHD, and that is individuals that are, if individuals are not vaccinated and they are quarantining, the quarantine period can be reduced from the 14-day period to a 10-day period without taking a test that's negative, or it can be reduced from 14 days to 7 days if the individual tests negative after day 5. So that's a lot. So let me say that again, and this is why it's important. Initially, the quarantine period for unvaccinated individuals is 14 days. That's what we see on the slide. And there's the conversation between 7 and 14, but unvaccinated from the guidance that we've been provided from DHD, which is generally a little more strict, if you will, than guidance that's from MD. And that's just because of the spread in our area. That's the way that it's been explained to us. But the update is from 14 days. So instead of a child being out of school for a period of a 14-day window or 2 school weeks, if there is not a test and they quarantine, then that guidance has been updated to 10 days if they don't have symptoms. If they test after day 5, then they can return back to school after 7 days, and the test is negative. They can return back to school after 7 days, or essentially, which would be the 8th day. So what we're recommending to those families that are in that situation, we have one of our sites that does not require that you engage with anyone. You don't go in the school building if you're in quarantine. You can drive through the site. You can take your test there, day 5, day 6, or day 7. And if the test is negative, it takes about 48 hours to get the results back. But if the test is negative, then they can report back to school on the 8th day. That was a lot, Christine. So if you have questions on that at the end, just let me know.
It makes a lot of sense. I think the clarification about how long you vaccinate or how long you quarantine when you're unvaccinated is really helpful for parents. Carrie, go ahead.
Yeah, I mean, for the sake of time, like our process exactly mirrors what Ironetta said, and I really appreciate the additional context you provided for the families on the call around the 5 days and you get a negative test and come back, that 7th day. That is not reflected here and is a really good policy. to enact to prioritize getting students back in school. And I just want to applaud MDHHS because for the longest amount of time, there were such broad strokes around the guidance here. But this is the first time that we're seeing visually that, everyone's prioritizing keeping kids in school.
Great. Thanks, Carrie. And why don't go on mute. I'm going to ask, I'd like to ask you a question related to when someone has to quarantine. So in your set of schools, because I know your company manages a few, that if a child has to quarantine, what type of supports are you offering students academically? And then there's a question from the audience, and I think that you can answer this simultaneously. Is there a virtual option in place for your students? And then Renette, I'm going to ask you to answer the same question. So Carrie, go ahead.
Yeah, so knowing that children all learn differently and have different needs, we provide both a virtual and like a paper packet option for when that tough decision is made that a child has to be out of school for whether it's 7, 10, 14 days. So the short answer is yes, we provide alternative options, both online and Google Classroom and paper packets that we send home with the families.
Great, thank you. Go ahead, Renette.
Sure. So we provide resources as well, but we do expect for our students to log into class while they are out. So whether that is from their own device or whether it's from a device that they check out from the school, we actually want them to be a part of class. And so if they log in, because that guidance has been provided for us by the state, that flexibility has been provided for us by the state when it comes to attendance. If they log in during that time, they're still counted as present. And that's really important for them to be present. So getting the work is one thing in terms of where we sit. Getting the work and having resources to work on is one thing, but we really want them to be able to get some level of instruction as well. So we do really, really encourage and ask that our families are logging in, whether it's from their own device or a device that they check out from their school.
It is really wonderful to hear that both of you and the districts have figured out a way to leverage what we learned from last year around virtual options. I'm not sure that every school is doing that, so it's so nice to hear that you all are really taking what we learned from last year and the good things, right? Because there were a lot of hard things. But that some of the good things that came out of last year, you all are implementing this year and making it really accessible for students to continue to go to school, even when they have to quarantine. So in terms of SEL, and I know, Carrie, I'm not sure that we've had you on before. We've definitely had DPSCD on before. I know that there was a lot that you all were providing in terms of social, emotional learning support. What have you continued to provide or have started to provide this year as kids are going back in just such a, it's still in this like really difficult time, and readjusting to being around so many people. So what type of supports are you providing in terms of social emotional learning? Go ahead, Carrie is off mute. So.
Oh, okay, sorry. Yeah. So, historically, we would have just provided adult training and development for folks such as our social workers, behavior interventionists, our assistant principals who oversee, student culture and things of that nature and overall wellness. But this year, we came back to school before school started. We had a 2-week in-house session with all of our employees and our staff at the schools. And we primarily focused on the development around trauma-informed education and ACEs, adverse childhood experiences, so that our staff could really understand the brain science of some of, the time away that our kids have spent away from school, and explaining to them, these students have been outside of school almost 500 days, a lot of them. So, what does that mean and how do you support, these individual students and their needs and figure out what their individual needs are, and addressing those in a very, individual way.
Great, thank you. Renetta?
Yes, and I see that our team did drop one of our resources that we use for families in the chat. We have a pretty comprehensive set of resources that we use, and we keep it as updated as possible because we know that options within the community do change, and so we want to keep it as fresh as we can. Much like Carrie, it really has started with the work that we've done with our leaders, and the expectation is they're moving back to buildings, honoring the fact that COVID has been and is a challenge for all of us, and it's a new normal that we're really looking to work through. When we really looked at how we were bringing students back and what we were doing with them collectively as an organization, we refocused our curriculum for the first 2 or 3 weeks of school. We're finishing up actually today, but for the first 2 or 3 weeks of school, just around social emotional learning. So preparing students for returning to the classroom to actually interact with one another. What are their coping strategies and how are they working through loss? Many of our students have had loss and they are still understanding how to get through that. So while we had some classrooms that were really moving in and they really started with the curriculum and what it looked like, it was still integrated with social emotional learning, which has really been important. And it's been a celebration for us for where we're starting right now. Each of our schools has school counselors as well as social worker services available. We also did an RFP with our organization so that all of our schools have access within the school buildings to mental health support, additional mental health supports. And that was through an RFP that we did. And a part of that was through, our ERA funding because we saw it as a need. So we've done a lot of work around that tier one expectation and how we are, focusing on our character development and what we're doing with expect, respect, and our character traits, but also how we're dealing with students in the tier two space where tier two is good for them, tier one is great for them, but they need just a little bit more. And then our students that are the most intensive that we put in that tier three space where they really need someone to just work with them, to work with them individually, to do outreach with the family, so forth and so on. So that is an area that is continuing to grow and develop for us. We know that it's a need. We saw it as a need, and it's an area that we've gone to the next level within our organization.
Thank you. And I'm going to ask our moderators, our chat moderators, if you can share what has been shared in our Zoom chat in the Facebook chat. I have one last question. We actually have a number of other questions, but I have time for one more question before Terry starts texting me, that I'm really off time. Are your schools partnering with, you talked about your partnership with the health department, but are you also partnering with other vaccine sites to bring vaccines to the schools for easy access for families and students? Is that something that you all are doing? Go ahead, Irenetta.
Absolutely. So we have a partnership as well with Henry Ford Health Systems that's come into our schools to do vaccine events. We're open. Our goal is to get as many vaccine events out there as possible. We started last May with our Teens for Vaccines initiative, where our students really became ambassadors around the vaccine and why it was important. So we did much like this, town hall sessions where we brought medical experts in, where we had students and families talking about the vaccine and why it was important to them. And we're continuing to do that. So, we work with the health department and they absolutely work well with us in getting the vaccines out, but we also work with other organizations, and Henry Ford Health Systems has been one of those.
Great, thank you. And Carrie?
Yeah, likewise, open to any and all partnerships willing to provide resources to our families and give them that wraparound support. To name one specifically, we've been working with Wayne State as well. And I'm just going to do a plug because I'm an alumni too, but they have this mobile health unit that's been really great. And they do everything from, student physicals and to other vaccines for our families outside of COVID and things of that nature. So that's been a very fruitful partnership as well.
Carrie, I am also an alum of Wayne State, and the Wayne Health Clinic has been amazing to work with. So has Henry Ford. I mean, we have had some really amazing partnerships on this town hall, but in general in the community to make sure that we're all working together to get people tested, to get people vaccinated. So thank you for sharing their flyer. And one of the doctors was just on, I think, 2 weeks ago. So a little shout out to Wayne Health. I want to thank you both so much for being with us. We have some additional questions. I'm sure we'll have you back on soon so we can ask those questions about parent engagement and some of the other things that you're seeing this year, since this is really an unprecedented year. I feel it as a parent, and we are really grateful that you all were able to get kids back in school. I am grateful that you were able to get kids back in school. It has been like night and day for my kids. They have just really enjoyed being around their teachers again and their friends and all the things that school has to offer. So thank you both so much for what you do every day. We really appreciate you, and we will see you back very, very soon. And I am now going to pass it to Miss Jametta Lilly so she can introduce our next guest. Thank you all so much.
Thank you.
Thank you. Thank you both. And thank you in particular for making sure that you're letting parents know that the information and your procedures are information that comes from the CDC to our Michigan Department, Health and Human Services, and then absolutely to our Detroit Health Department. We are delighted to have with us today Renetta Polk. Dr. Polk is with the Outreach Program with the Detroit Health Department. Renetta, welcome.
Hi, thank you. Thank you so much for having me today.
We're really pleased to have you. So you may have some slides to share, but I can let you know that we are really very aware that we are still in COVID. Okay. And that all of the things that we need to know about it, we're looking to you to hear information about the infection rate, hospitalizations, the unfortunate deaths that are still going on in our community, and ages. And then we can get some more information too. We're very interested in helping all of our folks better understand that while the vaccine is necessary, it doesn't mean it's 100%. It may be 99.910. So talk to us about what that means. And then also, what do we need to better understand about the discussion around boosters? So those are some of the backdrops, and I'm sure you've got a lot of great information for us. Let me let you go ahead and begin. Right. And if we have time, we're going to have some questions.
Okay, great. So I'll go ahead and share my screen. All right, don't see my PowerPoint screen.
Oh, it always takes just a moment.
I know, it's always technical difficulties.
And I'm just confirming, Christine or Molly, Renetta has all of the ability to screen share, correct?
Yes,
there we go.
She has all the ability.
All right.
Okay.
Okay,
here we go.
I got it now. All right.
Great.
Thank you. So again, thank you for having me. And I'll just start off with our current situation. You asked about numbers. So in the city of Detroit, we have 56,886 confirmed cases. And then we have also 2,376 confirmed deaths. So when we look at our children, in the past 14 days, between the ages of 1 to 9, we had 101 cases. And between the ages of 10 to 14, we had 68 cases. And then between the ages of 15 to 19, we did have 65 cases. We also like to look at our positivity test rate map. That's to the right. And in the city of Detroit, we are at 4%. And then when we look at the surrounding counties, they're all above 4%. And the state of Michigan is at 9%. So we use these numbers when we look at the CDC risk level of transmission. Right now in the city of Detroit, it is considered high. And so that just indicates that there's a increased risk of exposure of COVID-19. So with that increased risk, the CDC has recommended that everyone wear a mask in all indoor settings because that risk is high. The transmission risk, is high. And then when we think about or look at the Delta variant, It does continue to be a variant of concern. We know it spreads more easier, it affects more people. And then it also spreads much more faster than the other variants that are caused by the COVID-19 virus, sorry about that. And then when we look at infection rates in hospitals, they have increased in the last 2 weeks, and our death rate does continue to increase. So just a reminder how the virus spreads. We do know it spreads by those respiratory particles that are spread in the air. So that's why it is so important for everyone to wear a mask. And then with children at school to also wear that mask and social distance. And then when we look at our vaccination rate, we know it's very important for everyone to get a vaccine because we know it is an important tool to fight COVID-19. When we look at our vaccination rate, just a little over 44% of Detroit residents aged 12 and over have been vaccinated. But when we look at the surrounding counties and for the state of Michigan, they are all over 60%. So we do have a ways to go to get vaccinated. But the Detroit Health Department does offer the vaccine, as well as in Detroit Public Schools, we're offering the vaccine as well. We work with them. And then just a little information on the third dose and the booster shot. So the third dose, that is recommended for immunocompromised individuals. So those are people who may have received an organ transplant, on an active cancer treatment, or you may have a disease that affects or weakens your immune system, or maybe you're taking some medication that affects or weakens your immune system. And then other people who may have been told by their doctor or their healthcare provider that they are immunocompromised. So it is suggested that you do get a third dose 28 days after that second dose of your mRNA vaccine, and that's Moderna or Pfizer. And then recently, Pfizer was approved for a booster shot, and it is strongly encouraged for individuals who are Detroit residents, 65 years of age or older, or Detroit residents who are 18 through 64, and you are at high risk of severe COVID, and that's due to maybe an underlying health condition like diabetes, high blood pressure. And then also individuals who are 18 or older, and you may be living or working in occupation that puts you at increased risk for COVID-19. Now, this booster dose has only been approved for individuals who received the Pfizer vaccine. And so the vaccine is available to any Detroit resident, 12 years of age or older, or anyone who works in the city of Detroit. We do offer the vaccine at many locations around the city. We're at TCF Center, Northwest Activity Center, Roberto Clemente Center, Farwell Center, Clark Park, and Samaritan Center. And then we continue our community Saturdays at Greater Emmanuel Church, New Providence Baptist Church, and Galilee Church. And then also at Triumph Church on Sundays. We've made it very easy for anyone to get a vaccine. You can call us at 313-230-0505, or you can go to vaccinatedetroit.com to schedule your appointment. We have day and evening appointments, as well as some drive-in locations. We can also come to your house and administer that vaccine to you. If you are homebound, we do provide vaccines to those residents, as well as anyone who is living in the home. And then testing. We continue to provide testing at the Joseph Walker Williams Community Center, and that's at 8431 Rosa Parks Boulevard. It's the same number to call to get your vaccine, 313-230-0505. or you can go to the test finder at michigan.gov/coronavirus test. Because we know it's very important to get tested. If you have any signs or symptoms of COVID-19, we ask that you do get tested. Also, we want you to continue to wear your mask, but wear it mask up right. And if you are when you do wear your mask, we want you to wear a mask that is at least 3 layers. And if it is a washable mask, it should be a breathable fabric, and it should fit over your nose and your mouth at the same time. And then also we suggest the approved KN95 mask. Also, we don't suggest those masks that have those vents or those valves in them, because even though they're protecting you, once you exhale, you are exhaling those respiratory particles out into the air. And we know that's how COVID-19 spreads. Also, we see a lot of people who wear face shields, which is great, but under that face shield, you still should wear a mask as well. And then also to contact us, you could look at our website, detroitmi.gov/health, because we know to help keep our students in school, having the information about the number of cases that we have. We have all that information on our website and where to get a vaccine. Or you can call us at 313-876-4000. And we have a nurse's line. If you press option 3, there is a nurse available Monday through Friday, 8 a.m. to 6 p.m. to answer any of your questions. And as we return to work and school, many employers and schools are asking for a copy of your vaccination card. So if you have misplaced that card, we can get you a copy of your immunization record. And if you just call 313-876-4667 and press the number 2, then you'll hear a message again, and you'll press the number 2, and someone should be able to help you.
Renata, that was a, so I really had to tell
I
you.
answered all your questions.
Answered all of the questions
Okay.
that we had for you. There are 2 that I'd like to just kind of follow up on, and it's consistent with the discussion that we had with the schools, and that has to do with testing. And we know that, could you take a moment and explain that there are 2 different types of tests? And then there's the question about the reliability of testing. Could you address that a little, please?
Are you speaking to like an antigen test and an antibody test? Or okay.
So
Sure.
So one of the things that we hear pretty frequently is someone says, well, I have to get a test for work. What is that? And then there is the situation where someone has been exposed to someone who has potentially has COVID, and they go for a test, and they may get a negative that's later called a false positive. Just kind of asking you from the perspective of a nurse in the health department, how should we better understand that?
Okay, so with the antigen test or a PCR test, that's just to let you know that you currently have an infection. You may currently have the infection. So we do that test at the Joseph Walker Williams. And then also I know DPSCD has testing on site. So just depending on the test that they're offering, you can get that information as far as a negative or a positive test. However, if we're looking at the antibody test, that is to let us know how much antibodies you do have in your system. So, and it also depends on when you get that test. So if you have been vaccinated, and you are experiencing symptoms, the CDC is recommending that you wait and get your test at least 3 to 5 days after you've been exposed to COVID-19. So timing is very important when you get the test, because after you've been exposed, it will take some time for that exposure to come up in your blood work, in your test.
That's really important. So there is a recommendation if you've been vaccinated and you know you've been exposed to someone with COVID, to wait how many days?
3 to 5 days.
3 to 5 days to, in fact, not only to see if there's symptoms, but to go and get tested.
Yes.
If you are unvaccinated and you discover that you have been exposed to someone with COVID, what is the recommendation?
So if you are unvaccinated, you should wait about, those symptoms should come in 2 to 14 days. So once those symptoms appear, you should get tested.
So here's the question, and this really has to do with the issue around spread. So if I've been exposed to someone or someone's that I know have COVID, should I, while I may be deferring getting testing because we're waiting for symptoms to emerge, but should I be quarantining at this point?
Oh, absolutely. And that's to protect yourself and then to protect others around you. You should, yes, immediately quarantine at home. And if you're at home and you share that home with others, try to quarantine in a room separate from others. And then don't share like utensils or personal products or anything like that.
That's really important. And we really want to lift up this quarantine issue.
Yes.
And thank you again for mentioning about the mask. We're not doing the fashion statement, the mask that actually cover the nose and the mouth. And also want to thank DHD and the state for coordinating and providing support to our schools, as we heard Ironetta and the other representative, Carrie, speaking of as well. The last question that I have for you, does the health department keep an overall picture or document that shows where all of the testing sites and vaccines are in the city of Detroit? Who has that repository?
Yes. So if you go to our website and on that home page, it'll have COVID-19, I believe it says COVID-19 updates. And if you click on that square, it'll link you to all of our vaccine sites. And that is updated daily because sometimes we have pop-ups around the city at different locations. So it will update with those pop-ups as well.
Okay. But is that just DHDs, or is it also the accumulation of churches, CVSs, federally qualified health clinics, et cetera?
So that's just DHD.
Okay.
But if you go to michigan.gov/coronavirus test, it'll give you all the vaccine locations around the city. And you just put in your address and you can filter for those locations.
Would you be kind enough to put that put that right in the chat?
Sure.
So Renata, thank you so much. I know you were stepping in for our awesome, the other wonderful nurse that Tanea normally comes in, but as always, you give us great information and we really appreciate that. Thank you. If you could put that information in. And know that we look to you always for these updates at Detroit Health Department. Okay, families, thank you. So we're going down now to the last few moments to close out the program. First off, consistent with what we're saying is that there is no way that you should let anyone tell you that they can't get access to testing or vaccines. So the Detroit Health Department, in many cases, can come out to you individually. Wayne State University, University of Detroit Mercy have college and pediatric and other medical students out in the community ready to give you vaccines. In the chat, you also have the Wayne Health mobile units. Organizations, churches, schools You need only to contact them to try to make an arrangement for a mobile clinic to come to your location. That is at Wayne State University, the mobile health unit. That information is in the chat. You can also look at their calendar and see the various locations where you can go get not just the vaccine or not just the test, but also in that location, we're really proud to say Detroit Parent Network, our family health advocates are there to help you, connect you to food, connect you to childcare, connect you to primary care, because we have to make sure that we're healthy now and in our future. There's some other information we want you to know. Count Day. Count Day is coming up. Parents, please make sure that your children are in school. Their being in school is part of the dollars that come into those schools to make sure that we can educate all of our children. Also coming up is Break Light event. So we all know, and some of us, including myself, have unfortunately almost had accidents because some people's brake lights were not working properly. 482 Forward at Hope Village is doing an education and action team meeting around this. Also, New Paradigm is hosting a free brake light clinic for families this coming Saturday from 11 to 4 p.m. at 16520 Wyoming. That's this Saturday, 11 to 4 from, oh, thank you, good. We actually have the flyer, thank you. So want to make sure families, if you would grab that information. Something that's kind of cool for those of us who love the outdoors. It's a beautiful Michigan fall out there. Get out for Kite Day. Join the Congress of Communities and the Detroit Champions for Hope for a kite flying tonight at Patton Park from 5:30 to 7:30. This event is for families and for children. So bring your babies to children that are 8 years old, and all the children will get in free. You'll get a free kite, and there'll be some food and supplies while they last. Last two things we want to make sure that you know of is please join Detroit Parent Network tomorrow for two significant events. One, we are having a powerful parent equity cafe with the CEO from Education Trust Midwest, Amber Aurelio, to talk about not only funding our schools equitably, but what can parents do right now to advocate for change. Lastly, we want to let you know that, again, wear your orange shirt. Make it a point to get some information to better understand the struggles, the hundreds of years of struggle and repression and marginalization of Indigenous people. So we suggest to you that you can go to Facebook, do a search for orange shirt. Let's stand in solidarity with all those who have been marginalized so we can build up our community so that all children and families can thrive. And with that, we thank you for participating in another edition of our COVID313 Town Hall. Going to ask everybody if you could come on screen, because the way that we do this through collaboration. We do it by acknowledging and loving and sharing information with each other. Want to thank all of the 313 COVID team. And to all of our families out there, peace, love, stay strong. Many blessings. Thank you. Bye-bye.